Okay, welcome,
Hold on,
everybody.
give me a sec. Okay, you're on. Thank you.
Welcome to Thurston County Board of County Commissioners work session number 4 for Wednesday, January 13th, 2021. My name is Ty Menser, Chair of the Board. We have Commissioner and Vice Chair Gary Edwards. We have Commissioner Carolina Mejia, County Manager Ramiro Chavez, Assistant County Manager Robin Campbell, Kurt Harden, Emergency Services Director, Joy Miller, Stan Moon, and Margaret McPhee are the other three folks I see. And this is a work session with respect to the MEDIC One levee restoration. Public attendance can follow along on our Thurston County YouTube channel or join by calling 360-252-9020, pin 1234. I'm going to turn this to the county manager. We have 1 hour on this one, which is good. We've had a series of half hour. It's hard to get everything in, but we have an hour to address this topic. Ramiro, why don't you set us up?
Yeah, thank you, Commissioners. This has been a topic that we have informed or briefed the board that at some point the MEDIC One levee needs to be revisited, and has been based on all the many budget processes that we have presented to the board. Well, here we are. Based on the current budget projections, there is a need that perhaps for the board to consider the restoration of the MEDIC One levee. And Kurt is going to take the lead to walk you through some of the logistics as to what we can probably get to that point. And I believe we have members of the MEDIC One present, and they will be part of the presentation, I believe. Kurt?
Okay, thank you. And I'm going to go ahead and share my screen so that I have the correct version up there. And let me know if you should see MEDIC One levee restoration.
Yes. Can you put it into a PowerPoint mode?
Okay, I thought it was in the PowerPoint mode. Hold on just a second. It is in a PowerPoint mode, but let me see if I can do a different screen presentation. Let's try this. Is that better? Or is that the same?
Same.
The same.
Okay.
That's okay.
I had it earlier. Hold on. One more chance. Oh, there we go. How's that?
Yep.
There we go.
Got it.
Okay. I have about 6 screens, and when you start selecting, you have to get to the right one. Sorry. My Zoom skills are still needing to be refined. Thank you very much this afternoon, Commissioners, for sitting down with us. I want to go ahead and make some introductions here. With me is Margaret McPhee. She's the chair of the EMS Council, Emergency Medical Services Council. She's been on the EMS Council since 1993. She's also has experience because she's a former city council person for the city of Olympia. And so she's got a lot of experience in the EMS area and also with local government. And then with us as well is Stan Moon. He's the vice chair of the EMS Council. Stan is a fire commissioner for Fire District 6, also known as East Olympia. He's got over 40 years in East Olympia, not as a volunteer and also obviously as a fire commissioner, but also of note, he retired from Washington Department of Transportation after quite a few years as an assistant director there. So got a lot of experience there as well. And then Joy Miller is our fiscal manager. She is going to be here to answer any of the tough questions you ask me because I only answer easy questions. So with that, I'm just going to go ahead and run through the slides. If you have a question, please don't hesitate to ask because I know sometimes if we ask you to wait till the end, at least in my experience with me, I may forget the question. So please feel free to ask as we go through. We've done introductions. This is the agenda. And Margaret, I don't know if you had a couple of comments you wanted to make to open up the session. I think you're muted, Margaret. You might be muted.
Oh, again. Okay.
There you go.
Okay. Good afternoon. I wanted to start out by saying that Medic One began as an idea in 1974 by Dr. Rodney Brown. And at the end of that year, of the beginning of Medic One, he asked Dr. Tom Fell to take over for him while he went down to Stanford and learned a little about Medic One systems. And when he returned, the two of them established a fire department-based emergency medical system. And they did it all with volunteer time. Because, up until then, the emergency room had been run by all the local doctors taking turns. And so they both established a medical-based program, but they also established a medical-based emergency room with people skilled in emergency, how to take care of emergencies. As the service grew and the population grew, it was funded by ballot measures held every other year. And the citizens always passed the measures, so nobody thought much about the fact that they were doing this every other year until Bob Jacobs suggested when he was mayor of the city of Olympia that we actually extend that time. I joined, yes, as Kurt said, I joined in 1993 as the Olympia City Council's representative. But when my husband and I moved out of the city, the Board of County Commissioners, your board, asked me to, if I would volunteer and represent you all as a citizen at large, because I had enough experience and I honestly didn't really want to give up the experience. So we went in 1999, we went out for a long-term levy, which was supposed to last maybe 6 to 8 years. But with incredibly careful attention to budgets by both Steve Romines and Kurt Harden, we made it last 22 years. And it's time. The population has grown, the technology has grown, and yet we've always managed to use the monies that came out of 1999 levy. And it's time that we need to, well, we need a change. We need to ask for more money. We have one of the best systems in the country, and it's been recognized as such, probably second only to Seattle. And so given the population growth and the technology growth, it's time to look at a new way of funding.
Okay, thank you, Margaret.
Mm-hmm.
Okay, so the purpose for this afternoon is to provide information, but that second sentence is really what we're talking about. And that is that the current Medic One revenue and operating expenditures are unsustainable beyond budget year 2021. And as the county manager mentioned, we've known this has been coming. It's not a surprise, and we've reached that point where we have to make some decisions. What I want to do is, this is just a quick of what we're going to talk about here in the next several slides, but just an EMS overview. So I never know with my audience who has what information on what EMS is and what it does. So I'm going to give a quick overview as we walk through this. And the first one is going to be the EMS components. You can read everything on the slide here, but essentially one of the areas I want to point out is the middle 3 bullets. We work with 12 fire departments, approximately 700 providers, EMTs and paramedics across the county, and 2 private ambulance companies. And in addition to that, the 2 hospital emergency departments as well. So, you know, when we're serving over the 280,000 people in Thurston County, that's quite a responsibility. And so these are the components, EMS components that we're talking about and addressing. And Medic One is just one part of the component. One of the things that we look at is our EMS system in Thurston County is a tiered response. It's integrated and synchronized between citizen involvement, BLS, what we call BLS Basic Life Support, which are EMTs, and then Advanced Life Support, which are the paramedics. And all of those pieces require the other two to work. In other words, the system isn't going to work if one of those components are missing. One of the areas that I want to show here, in 2019, we had just under 36,000 EMS 911 calls. 84.6% of all EMS 911 calls to fire agencies are EMS. In other words, out of those calls to the fire agencies, 15.4% are for fire, 84.6% are for EMS. And so when we're talking about the 12 fire agencies, you can see that there's been a shift over the years in EMS response versus fire response. Go ahead. And so I didn't know if someone had a question. Basic life support. BLS is essentially emergency medical technicians, EMTs, and for every one of those 36,000, just under 36,000 calls in 2019, BLS was dispatched for response. In other words, we dispatch BLS for every 911 EMS call, and we consider it the backbone of EMS. For the Medic One perspective and piece, we provide initial training to basic life support and the ongoing required education for the EMTs, along with EMS equipment and medical supply support. And also Medic One provides to the general public CPR and AED classes at no cost to them. And also it's important to note, I put this bullet in there, 74% of cardiac arrests occur in the home. So we feel that whenever we have citizens doing CPR, when EMS is in response, that means that we have almost double the chance of that patient surviving. Advanced life support, which is our paramedics. Medic One contracts with 3 fire agencies for the paramedic support. And you can see them listed right there, Lacey, Olympia, and Tumwater. Also, out of those paramedic support, we have medic units, 7 frontline medic units placed strategically around the county for our response times. And we also have 6 reserve units to augment those 7 in case one of those or a number of those go down for maintenance, and or we have a need for surge capacity, such as the Amtrak train derailment. And Medic One financial support, it's 100% of the equipment and supplies for the medic units and 80% of all the paramedic salaries for those 3 fire agencies to respond across the county. Our medical program director, or MPD, he's an emergency room certified physician, and all the protocols that we utilize in EMS in Thurston County, and it's several hundred pages, he develops and works and creates those protocols. Eventually, those protocols are all approved by Department of Health, but he also operates, all the paramedics and EMTs operate under the medical program director medical license. What that means is that one individual physician has all 700 providers working under his medical license, and the medical program director is appointed by the State Department of Health. And it's important to note that under the state statute, DOH assumes liability for medical procedures that occur in the field under the MPD's license. So in other words, a lot of times people ask what happens if there is a legal challenge to what one of our providers did in the field, and that's done and that's defended in court by the Attorney General's office. And if there's any kind of settlement, that's done and the Department of Health pays that settlement. So in other words, by statute across the state, the paramedics and EMTs are covered for medical procedures by the state. The EMS Council, I'm not going to spend a lot of time here, but the EMS Council, I will tell you one area, and if you can see this 12 voting members, if after you submit the slides, you realize that this adds up to 13 and not 12, you realize that you probably were a product of the Florida public education system and you really can't count. So I will tell you that it's 13 members, but this is designed to show you that we have a cross section of the community as part of the EMS Council who provides advice and recommendations, not only to Medic One, but also overall for EMS and also for the Board of County Commissioners. Now I'm going to do a little bit about Medic One and some of the background and history. Now I will tell you that Margaret alluded to a lot of this, but essentially Medic One was authorized by the voters back in 1974. And the last permanent levy, the last time Medic One was in front of the voters was 1999. As Margaret talked, we have not been in front of the voters since then. But at the same time, it kept going to a biannual levy vote that was costing $50,000 per year at that time for the elections. And so it was a permanent levy that was authorized, and that carried us forward until today. However, back in 2008, the legislature changed statute and limited revenue collection on levies to 101% of the previous year. For Medic One, that meant that we, from 2008 to 2019, just under 33% increase in the revenue coming in. But in the same time frame, the budget increased 71%. And now some of the reasons for that increase was, one, we ended up placing a new medic unit into service in 2012. And we took one medic unit, I call it a half a medic unit, but it was a medic unit that was only in service for 12 hours a day, that went to 24-hour service because of the needs of the county. And that happened in 2014. Additionally, healthcare costs go up more than 1% a year. They've averaged 5% over the past 10 years, healthcare costs, the medical equipment, supplies, et cetera. And then in the next 10 years, we went to the Centers for Medicaid and Medicare Services at the federal government, and they're projecting a 5.3% annual increase in healthcare costs over the next 10 years. Additionally, our 911 call volume in 2008, 24,392, jumped to 35,997 over that same time frame. That's a 47% increase, 47.5% increase. So overall, while our revenue still went up, it went up at 1% a year. And then at the same time, our expenditures, our expenses went up significantly higher. This graph is just going to show you and depict that cost. And what we have over here is fund balance on the left. You have the years at the bottom. First line here, this blue line, is the Medic One fund balance. And you can see at a height of around 2009, 2010 timeframe, around $19 million. And what you see right here, this line, gray line, is the budget. And then this green line is the revenue coming in. And you see the green line is steady, but at the same time, it's not rising very fast. So that's where we got to today in 2019. And by the way, I just want to point out that all the numbers we're using, if it's through 2019, it's actual expenditures or revenue or actual numbers. If it's 2020 or farther out in projections years, we're using estimates off the 10-year Thurston County financial plan. So going to go through some of the options that we had, and I'll go through these quickly. These are the options that we considered and that we're going to talk about. The first one is planning assumptions or planning factors. One piece, this first bullet, the auditor's office, both at the state and the county level, recommends that restricted funds, dedicated funds, maintain a 2-month average operating expense as the minimum fund balance. That's essentially intended to ensure that for purchases that Medic One does, we have sufficient fund balance to clear that warrant or pay that bill. Essentially, we have enough fund balance to cover the checks that we write. This in 2021 is $2.4 million. In 2021, the budget that was approved in December is $14.15 million. We're making an assumption that that's going to remain static, and that there are going to be no future pandemics, disasters, or anything else that's going to increase that cost. I have to make an assumption somewhere, and I'm making that right here, because if we increase the budget due to unforeseen circumstances, that's going to impact the ending fund balance as well. And then that the Medic One ending fund balance, and that's coming from the 10-year plan, will be $3.15 million. So this slide is going to show when the EMS Council considered a budget reduction option. Let me go here and say the years are right here, 2019 to 2023, and then we have budget, and that's either actual budget numbers or projected budget numbers, the revenue. Medic One fund balance, and then over here, if going through a budget reduction process. We get down to 2022, and what we show is there is a need for $13.37 million. However, there wouldn't be sufficient revenue to cover this amount, so we'd have to do a 1.6% reduction in 2022, as reflected right here, that $211,000. But in 2023, you can see it's extremely significant because we needed $17.2 million, which is a 26.4 budget reduction, and that's $4.5 million. The issue here is for these costs, this $211,000, $4.5 million, that's all gets shifted to local fire agencies because we still have to respond. They still have to provide care, but that cost then directly impacts them. So under the Levee Lid Lift considerations, it's to restore the existing permanent levy to a rate of 50 cents per thousand over a 6-year time frame. So I'll tell you right now, in 2020, the assessed value is 29.9 cents per thousand. The Levee Lid Lift over the period of 1 to 6 years would raise that to the 50 cents, and then the levy amount remains upon at the end of 6 years upon expiring. So in other words, what that means is they reverts back to the permanent levy at the 101% revenue collection from the previous year, unless after 6 years, the county would go back out to the voters. For a Levee Lid Lift, a simple majority is required. It doesn't require the 60%, and validation of the previous general election is not required. So it's whoever votes, it's just 50% plus 1 vote. What we've laid out here is FutureMedic One Requirements. What that means is that in 2022, first of all, Medic One does not have a ER&R fund. As you notice, in 2023, there's a significant jump to 17.2 million for the budget requirement. We are looking at replacing 6 medic units. They have a lifespan of about 10 years. In 2018, we replaced 7. So we'll be projecting to replace 6 medic units in 2023, but that cost comes out of the operating budget because we don't have an ER&R capital fund established. We're proposing, number one, to establish an ER&R capital fund. We're estimating that's about $750,000 a year, but that's going to help level out the Medic One budget so we don't have these significant jumps or swings in the budgeted amount. In 2023, we're looking at increasing the BLS support about $250,000 on an annual basis. And we're looking at establishing a quality control, quality improvement program. That's going to cost about $150,000 annually as well. In 2024, $500,000 BLS increase annually. And then in 2025, we're looking at a need for an 8th medic unit to be stationed in the county. The population is growing. Our population demographics are changing. I got to tell you that we're an aging society. Our average age in the population is going up, which means more and more frequent medical issues. So the annual operating budget for a new medic unit is about for a medic unit is about 1.2 million a year. A one-time cost for a medic unit is about 1.5 million. And then an increase that's necessary for the 250,000 for BLS increase. And then in 2026, capping that off with a $500,000 BLS increase for the 12 fire agencies. So what we want to lay out is also what's the impact of a Medic One Levee Lid Lift across the county. So we got from the assessor's office, the average parcel value in the county was $375,900. In year 1, the proposal is to take the levy up to 34 cents per thousand, which is a $15 million increase. We need this just to maintain the current maintenance level of the budget, so we don't have to go through budget reductions. And then to increase and augment services, we're looking at a 4-cent increase in year 2 to 39 cents, and a 42-cent increase, a 45-cent all the way up, so that eventually this annual increase that you see right here on the right totals $75.20 for an average assessed parcel value over 6 years. So the proposed levy increase, as you lay it out, and information here is, I got the year listed here on the left, the budget amount here, revenue here. I put available fund balance less the 2 months that were required by the auditors. And what I have is available fund balance here. And on the far right, I have the 2 months fund balance that we have to maintain. This number plus the 2 months fund balance equals the total Medic One fund balance. But I want to show what's available for the budget, not the total fund balance. And then I have here the millage going up and the increased amount in this next column. And what you can see here is after the 6th year, it's a gradual increase in the Medic One fund. After 6 years, we can assess the situation and turn around and determine if we need to go back out to the voters and make a recommendation there, or if we revert back to the permanent levy at the 101% cap and then operate from there. So that gives us some opportunity, but also it allows for maintaining and improving EMS service across the county. So the EMS Council made a recommendation for the Board of County Commissioners that to place a Medic One ballot measure on the August 2021 primary to increase the Medic One levy to a full 50 cents per thousand through an incremental increase over 6 years. And then that gets us to our discussion point and next steps. And at this point, I was going to ask if there's any questions or comments that anybody wanted to make.
Kurt, I'd like to add one thing, and that the disadvantage of being so good with the budget is that people haven't heard from us in 20+ years. And so we do have perhaps I hope we can get this out publicly very soon.
Commissioners, questions. Commissioner Mejia.
I don't have any questions at the moment. Thank you.
Commissioner Edwards. Give me a chance to unmute there. While we're waiting for Commissioner Edwards, I'll just ask why August is the better time than November.
So we looked at it, and that's a good question because we asked ourselves that, and we had a lot of discussion over the timing of a ballot measure. And the thought is that while we feel confident that we can make a good case for this levy ballot measure and the Levee Lid Lift, if for some reason that it was not successful in August, it would give us the general election opportunity to go back to the voters with a much scaled back, bare bones, just to keep response areas running, that we could go back to them and ask for additional help. And it would allow us to understand what the voters were talking about if they said no. We feel it's a very good argument that we're making. We can logically spell it out. It just gives a fallback opportunity in case it's necessary.
If I might comment on that too, you see BLS increases, and as you saw from the response, the fire departments, current title fire departments, we're really EMS response agencies that occasionally also go to a fire. And we really appreciate and need the support, the BLS funding support from the Medic One Fund. And many of the departments have to go out for excess levies above their prescribed $1.50 just to keep operating. And so we really enjoy and appreciate and will very much benefit the service we provide from that enhancement through this fund as shown in the budget.
And one of the other considerations is because it doesn't require a validation from the previous general election, we felt therefore that we didn't need, we were fairly safe in going into the primary where we didn't need a certain turnout in order to validate the election.
Right. Yeah, and I mean, I remember in the budget process, we had two placeholders for ballot measures, and one was this one, I believe. One was the criminal or the public safety, and one of them had a really high dollar amount attached to it. One of them a really low, and I remember asking that question. And I guess I'm going to ask Robin. I mean, we know from our courthouse ballot proposition that if you're the only thing on the ballot, you're looking at $177,000 to run the election, at least in 2020. And we know that can be, that can be a small fraction of that if there's lots of things on the ballot. And Robin, can you remind me what we had in the budget for this particular ballot measure as our guesstimate or our placeholder?
So I'm going to have to look that up. Kurt may remember.
I have it.
I can answer. Okay. Go
Yeah, I
ahead.
was gonna say, we have $180,000 set aside in the Medical One budget as a placeholder only for if this is placed on the ballot to pay for that. We did use the courthouse. We talked with the auditor's office as well. And this is if it's the only measure on the ballot, that would what we anticipate the cost to be.
It would be extremely unlikely in the August election that this would be the only thing on the ballot. So I believe we set that up as a proviso, and any money not spent on the election would revert to the general fund.
Or revert to the Medical One fund.
Medical One Fund.
Yeah. I don't want the audience to get excited all of a sudden.
My question, I guess, so my question, I guess, is between November and August, because you have primary and you have municipal elections. So, I mean, is November even less expensive? I mean, just so we know what we're, just so I know the financial consideration. I understand Kurt's argument about the ability to come back with a scaled back proposal, but the financial component of this, I know it varies, but speaking generally, is it true that November is more, it would cost less than August when it's the same elections primary? I mean, obviously there's special things that can go on the ballot, like special propositions and whatnot, but your general political elected officials elections are there in August and they're there in November. I don't know. So I'm wondering if maybe that's a very small consideration, because, April versus August is a huge difference, but August versus November may not be that big of a difference.
One of the
It all depends on what else goes in either month.
Right. The other piece I was going to add is we have budget cycles starting up again, and our budget will be due, and we'll have to base it on existing revenue if we do a budget for 2022. If we look at the August primary and this passes in the August primary, then we have the opportunity to say, okay, we know what our funding will be in 2022. If we don't have the election before we do the budget cycle, we're gonna have to wait until November, and then we're deep into the budget process, public hearings, et cetera. And so at that point, it might be more challenging to try to adjust the budget. Not that it can't be done. I'm not saying it can't be done, but it might take a few more steps. And I'm a lay person when it comes to budget. I defer to Robin for actual specifics.
Kurt, do you mind to unshare your screen? Because I can't really see, it's hard to manage the meeting when I can't see everybody's.
Sorry.
Yeah. Commissioner Edwards, look like you're unmuted. Do you have a comment or question?
Yes, sir. First of all, I was privy to a lot of what is going into this, so I don't have questions about that, and I certainly support putting this on the ballot. I do think the demographics, remember in Kurt's presentation, he talked about an aging community, so that transfers into a positive vote for this type of a thing. So I think it's real important to move forward with this. I think my preference is, without all the other input that's going to come in, is for the primary to be the date. But I think there are so many unknowns yet on this COVID thing that I think medical issues are going to be of the utmost importance to the community as time goes on, because we're not going to be over this thing right away, and we're seeing overloads on the hospital going to have ambulances and fire. Everything is going to be kind of sensitized towards this whole situation that we're dealing with today. So I think the timing is right. I'm looking forward to working on this. I think we're in good shape, and it's been well thought out.
Okay, thank you. Ramiro, anything that you wanted to?
No, not really. I think it's, in terms of the next steps, obviously there is a timeline in which the board may need to take a formal action to put this on the ballot. And so we'll work with Kurt just to make sure that the board has the opportunity to exercise that option on a timely manner. So I'm not trying to be presumptuous. The board will vote on putting this on the ballot, but it will give you enough time and enough latitude for you to exercise that decision-making process, just to make sure that there is not a missed deadline associated with the August 2021 election.
Yeah, that makes sense. We'll consider this, understanding that August is the suggested date. We'll consider this in due course so that can be placed on in that ballot if that's the wish of the board. So that makes sense to me, and I'm comfortable with that. Anything else that you guys need us to know at this point? I appreciate you being here, Robin. Go ahead.
Just wanted Kurt to tell us, what is the deadline to get all of the information to the auditor for the August?
Yeah, the deadline is May 14th. If the board was going to place this on the August primary ballot. So what we're looking to do is to see if they would be agreeable for a March placeholder for the board's agenda for one of their public meetings.
Coming up faster than one would think if we're talking about August.
Yes.
Yep. Okay. Well, we have a work session at the end of this month where we're going to discuss some of the different competing revenue proposals that we've seen and trying to balance it all out. And obviously this is a priority.
Yeah, we'll include this item on that conversation, Commissioner.
Yep. Okay.
And as always, as you saw, my contact information is there on the slides at the end. If anybody has questions, feel free to reach out to me.
Thank you, Kurt. Thank you, Stan and Margaret, for being here.
Thank you.
And we'll see you next time.
Okay, thank you. Have a great day and enjoy the sunshine.
Yeah, I will.
What?
Remember that rain for January 20th, Kurt.
I will work on it. I will work on it.
Okay.
No.
Oh, can I do it early?
Early.
So when would this come in front of us to vote on?
So we'll bring the
We end it.